Hello and welcome to Impact Health Link. Impact Health Link Manipur Miyambu. Haksel gi maramda hena bhab hananaba hena khanghanabagi adugumba makalgi program ni. Ngasi ekhoi program sida heart attack amasung hypertension haibagi hiram asida sugaina takpi nabagi damta ekhoi rakta link sin nun leibirba si Dr. Professor Amal Kanti Saint mahasi medicine da MD tawrabani aduga lolunna cardiology da su DM tawrba Dr. Amani sigi sumathakta Chahi kunmanga kuntaruk hen experience su leiraba amasung France tagi interventional cardiology da fellow siloisan biraba Dr. Amani haujik na she is a hospital and research institute Imphal da cardiologist oina thabuk tawibani. Welcome to the show, doctor.
Thank you very much.
First of all, doctor, we would like to know what heart attack is.
Okay, it's a very important question, and actually everybody hears this very often, what is heart attack, but I think the general public, they exactly do not know what is heart attack. They think that when the heart stops, it's heart attack.
Okay.
It is not heart attack. Heart attack is when one of the arteries supplying the heart, I don't know the picture, the artery is, I have a diagram. There are three arteries which supply the heart. If one of the artery gets blocked, then there is no further circulation down, and then there is some muscle damage, and then it causes, I'll come to that later, but it causes severe chest pain, and then it causes sweating and everything. So this is heart attack when there is complete blockage of the circulation in one of the three arteries. All the three can get blocked at the same time. So this is heart attack, but many people confuse it with heart failure. So heart failure and heart attack and heart block, many people say heart block, so they are all different terms. Heart block when the electric system doesn't work, and then the electric current do not go, and then you need a pacemaker, so that's a heart block. And heart failure is when the heart is not pumping properly because of different, even heart attack ultimately leads to heart failure. So heart failure is different, heart block is different, and heart attack is different. Heart attack means when one of the heart arteries gets blocked.
So how this artery get blocked?
Yeah, so that's that means you want to ask what are the causes of what are the causes of heart. See, there are traditional causes like high blood pressure, very high cholesterols, family history of high heart attack. If the family, if your family has somebody who has heart attack below the age of 55, then it's called positive family history. That means there is some genetic problem, and then you also have a predilection for the heart attack. That is one. Diabetes is very common, and smoking. Mainly smoking, hypercholesterolemia, high cholesterol, hypertension, okay, and family history, and then obesity and other things will come. So these are the traditional factors which are all over the world. But in Indian setup, India means particularly South Asia, not only India, South Asia. South Asia means India, Pakistan, Bangladesh, Lanka, and then this side, all this mainly five states, Nepal. So we have heart attack, and we have, besides these traditional factors like high cholesterol, high blood pressure, cigarette, obesity, family history. Besides that, we have some particular problems with us. Okay, they are genetic. We have there is a biochemical which is called amino acid which is called homocysteine. So sometimes we have that. Then we have another factor which is called lipoprotein little a. That is also somehow in Indian populations very high, and that is a genetic marker, okay? And then somehow our blood clots coagulability, there is a factor called PAI and all, little more. So we have some different factors compared to the Western population of Far East. But traditional factors are five: smoking, hypercholesterolemia, hypertension, diabetes, and family history. These are the five things. These are the most important causes.
Okay, and but how alarming it is, or yeah, I mean, how prevalent is this heart attack?
Yeah, that's why it's. You see, I was just seeing the latest data. How much? Where's people got? Yeah, here. I was just going to the latest. See, there are 17 million deaths all over the world. That means 1.7 crore people die of heart problems, heart attack.
Okay,
and then there is a very big misconception that the heart attacks are more common in affluent countries. This is a misconception because they eat a lot of, but actually it was in maybe 50s and 60s. but the things have reversed. Now the heart attack, 75 of the deaths in heart attack is in the lower and middle income group. Like West Europe, America, they have much lower. And Russia, eastern part of India, this country, we have much more deaths from cardiovascular disease. Why? Because in 1950s, they also had a very huge mortality. But they understood why it is happening, why. So they found out the risk factors in 60s. Smoking, number one, smoking. Hypertension, diabetes, they understood, the smoking was not related, nobody knew that the smoking causes heart attack. See, if you see the films in 1950s, have you seen films?
Yes. So they smoke big cigars.
Everybody was smoking cigarette, that it was not banned. So that sort of stimulated everybody to smoke. And then the incidence got down. But they came to know, in 60s, the US came to know that smoking is a very important cause of death. And there is a vigorous propaganda to reduce smoking, and then they found that hypertension is also caused. So because of this controlling hypertension, controlling cigarette smoking, overweight, United States have reduced their heart attacks incidence by 50%. But South Asia, India, China, the incidence has become double more. Because we are sort of in that, they did massive propaganda, they controlled, they preemptive. Once they found patients high blood pressure, cholesterol, before they had developed heart attack, they start treating that, which we were not doing. Now we are doing. So because of that, the incidence of heart attack has reduced to 50%. So that means effective, and that means we should also do it. Okay. And then what did you ask? Why it's important?
No, yes. The prevalent in the Indian subcontinent.
See, it's much common, much before, and then as I said, it's not that is not only India. It is 75% of the heart attacks are in developing and underdeveloped countries, which is a truth, and which we had a conception that the high income rates, because they're eating a lot of fat, so they have heart attack. But it's not like that.
Okay.
Even the India, because of maybe economic growth and all, our diet patterns change, we are having. And one thing now, in this context, I want to tell you that Indians, particularly South Asians, they have a much more incidence of heart attack compared to the Western white population of Far Eastern. Our incidence of heart attack is much more, and our incidence of heart attack below the age of 40, is almost 4 times than the Western population.
Which is why?
You won't, if you go to England, if you go to US, you will hardly find anybody 35, 40 years old having heart attack. But you'll find, if you find somebody, there will be Indians.
What's the reason behind it?
So that is because we have only, not only the traditional factors like high blood pressure, cholesterol, diabetes, we have one big problem, which is called metabolic syndrome.
Okay.
Again, the picture. We have everybody, see, we have everybody, we get we put on weight, we eat and we put on weight on the stomach, truncal obesity. So it's called truncal obesity. This is actually obesity, but this is different than the generalized obesity. Once you have this, then you become diabetic.
All right, we'll have to take a short commercial break here. Maraktan ako'y break amtang labas ng break matungda mong health impact health link makata ni miyang tabiyo.
Mano nung tagi chari ba marumarang yaw bachingjak sing siyang. Masin hakchangi pangal amadi liver sohan batanatana. Pok naba acidity chaba tumdabana chingba kya narikya.
Imana pirakpa hakchang ngakthuknaba hidak lairisidi lipset namanaba singa nungtiri party sanga chadrabadi sukya magyadabra adumna khangra male masina puknaba thinbagi awaba thohanba yai
lipset nungtigi chabana acidity chaba tumdaba khong haba yataba phali aduga chaksu laman le
liver bu farabadi punsisu superhit oire
Mano nung tagi chari ba marumarang yaw bachingjak sing siyang. Masin hakchangi pangal amadi liver sohan batanatana. Pok naba acidity chaba tumdabana chingba kya narikya.
Imana pirakpa hakchang ngakthuknaba hidak lairisidi lipset namanaba singa nungtiri party sanga chadrabadi sukya magyadabra adumna khangra male masina puknaba thinbagi awaba thohanba yai
lipset nungtigi chabana acidity chaba tumdaba khong haba yataba phali aduga chaksu laman le
liver bu farabadi punsisu superhit oire
Welcome back to Impact Health Link once again. Doctor, we now want to know that is there any age or gender factor as far as occurrence of heart attack is concerned? Age factor or gender factor?
Yeah, I'll come to both.
Mm-hmm.
Age, as I said, that we are having heart attacks in much younger population.
Mm-hmm.
Generally, if you go to the West, heart attack before the age of 55 is very rare. Generally, they develop heart attack in the 60s and 70s.
Mm-hmm.
But we, below the age of 55, our incidence is much more. And as I just told you, below the age of 40, we have 4 times.
Okay.
The most important cause is again smoking and the truncal. We have a specific problem. We develop trunk which is called waist obesity.
Mm-hmm.
Okay, it is not simple waist. Once you have a waist obesity, then your insulin doesn't work.
Mm-hmm.
Then you automatically become a diabetic. Okay, so this, and then there are other lipid abnormalities. There is one lipid which cholesterol which called triglyceride,
Mm-hmm.
and which is a bad cholesterol, and there is another cholesterol which is called HDL, which is good cholesterol. So once you have truncal obesity, the good cholesterol goes down, bad cholesterol goes up, and even you become diabetic because insulin doesn't work.
Mm-hmm.
It's called insulin resistance. That means you have insulin in your body. Insulin is normal, but it doesn't work because of this fat. And as you reduce it, it works.
Okay.
So all these people who are diabetic because of this, if they reduce exercise, their diabetes goes away. And of course, as the diabetes goes away, coronary artery, heart attack and everything will reduce or at least disappear. Okay. So
Okay.
we have this unique problem. And then we have, as I told you, there are some genetic abnormalities like there is a small lipid, which is called lipoprotein little a.
Mm-hmm.
Somehow around almost 10% of our patients have that, and that's from childhood.
Mm-hmm.
So actually, if you screen that in the first decade of life, you can find out that this child may have a heart attack and this child will not have. So we have genetic markers.
Mm-hmm.
So it is not only traditional cholesterol, that we have some genetic, we have homocysteine. Some people have genetic homocysteine abnormality. The homocysteine goes up, which coagulates the blood. In such cases, the blood coagulates very fast. And then the basic problem in heart attack is the blood clots, and doesn't let the.
And what about
So these are-
gender? If the occurrence between the men and the women are similar, or
So, men and women, the occurrence are different in all over the world, and Indian women are no different.
Mhm.
But till they are in their reproductive life,
okay,
till they are till they have their menses, monthly cycle. That means the estrogen is there.
Mhm.
Maybe 45 or 50. Till that time, because of their estrogen,
Mhm.
they are protected from the heart attack.
okay,
So this is automatic protection. But once they develop menopause,
Mhm.
then the incidence actually becomes much more than even
Men.
a man.
okay,
Okay, so this is, and then, but before menopause, if they are diabetic and they smoke, like in Western countries, this is apply. In India, diabetes is also not that common in women, Indian women, and smoke also is not that common. But in Western countries, both are there.
okay.
They smoke. So their incidence of females having heart attack is much more in West than in India.
In India as well, okay. You mentioned about people who are below 40 years of age, 4 times more than the nominal people. Is there any specific reason apart from the obesity, or should I ask why the people below 40 do have obesity? Is there any specific reason? why
Yeah,
they-
that as we are developing as economic growth is taking place. You see, in 20% of Indian population, which is called middle class,
Yes.
they are actually much better off than even in Western countries. You find our middle class is maybe earning more money than them.
Mhm.
So with economic development comes urbanization,
Mhm.
come mechanization,
Mhm.
come this sedentary life, because now if you don't walk, you have a car.
Mhm.
You have a husband wife are cooking, so you don't cook food, you get from KFC. So all that, because of this all environmental changes, this urbanization is causing this. Once you eat this food, I'll come to the food later. Once you eat food, then again the same thing, you put on weight, and unfortunately Indians put weight in their tummy.
Mhm.
That is the biggest problem.
Okay. And what are the major symptoms? How do you know that someone might have heart attack?
Yeah. So this is now coming to the symptom. That's very important, important question, because You know, heart attack is when you know, out of these three arteries, when artery gets completely blocked.
Yes.
It's heart attack. When no flow is going down and it's a very severe discomfort. You know, if you tell pain, they will say no, no. Whenever I ask, you have pain? No pain. I have they said I have discomfort. I mean, they feel something very heavy, you know, inside, and they are like cannot breathe, and then they may have sometimes profuse sweating. Yeah? And it is not for 1 or 2 minutes. Heart attack means this should be more than 30 minutes. The time is a problem. You know, time is the criteria. If it is more than 30 minutes, then it's heart attack. If it is less than 30 minutes, then we call it angina. If it is just 10 minutes, then we call it, you know, stable and unstable. So basically, you understand that there is a term called angina. There is a term called heart attack.
Okay.
Angina, when it's not completely blocked, so the heart muscle is not dying. Only blood flow is less. So when he walks, he feels pain and stops, goes away. But
Okay.
heart attack means complete block. Even if he stops, whatever he does, this pain goes on.
So when you say that if the pain exists for more than 30 minutes,
30
it
minutes.
may be heart attack.
Yeah, it's very strong chance of heart attack, and of course associated with sweating and other problems. But at this stage, I want to tell you one thing. You know that as you suspect heart attack, you should go immediately to a place where you know, we need to break that clot. There is a clot, simple thing. There is a clot in the circulation. We have to break it. There are one way is by giving one medicine, which this very good medicine. It's called Velix. It's a very latest medicine. It's quite costly, 35,000–40,000 rupees. But you can give just like a bolus.
Okay.
This is called thrombolytic. Thrombolytic means clot breaking.
Okay.
Before they were very slow. You have to give them in 1 hour. Streptokinase, and then it used to, you know, have a lot of problems. This is very safe medicine. So you just give. This is one way of blocking clot. Another way is that we do, you know, if the hospital they come like our hospital, we have cath lab facility. We can do mechanical. We can just go to the artery and open it with balloon.
Okay.
That is better than this. But most of the centers do not have that. So we have to open the artery in heart attack. That is the treatment, and then for that they should go immediately to the hospital. One big problem in India and everywhere is that they confuse this chest discomfort with acidity. This acidity has killed so many patients.
Okay.
Because if the patient has chest pains in the morning, he thinks, oh, acidity, he takes some Gelusil, some antacid, rabeprazole, this and that, 5–6 hours he will wait. When he cannot tolerate, and then finally he will go. But in heart attack, the time is muscle, time is very important.
Okay.
Because heart circulation closed, no blood is going. Every minute the heart cell is dying.
Okay.
So if you come in half an hour, you may be 1% of the cell death. If you come after 10 hours, almost 20% is death. And actually, if you come within half an hour of chest pain,
Okay.
then heart attack can be aborted. Aborted means you give this injection within half an hour,
And
it will
open the block.
completely open, and abort means there will be no heart damage. The heart will be almost as normal as possible. So earlier the better. Okay, as soon as you feel something problem, don't hesitate, because this hesitation is very common in India everywhere, particularly at night. Arey chalo subah tak dekhenge. They think arey morning till morning I'll watch. But
Yeah.
that is the worst thing.
Okay.
You watch till morning, by that time 6 hours was over, and 6 hours and 12 hours is the best time to give this injection. Because by 12 hours, most of the 10%, 20% muscle damage is already there. You can't do much, you know, and then ultimately even if patient survives, he will not be able to walk much because heart